بسم الله الرحمن الرحيم. أنا هبتدي دلوقتي أن أونلاين ليكتشر للبوست جراديويت. أنا اسمي خليل عبد الخالق، وأتمنى أن الليكتشر دي إن شاء الله تبقى كويسة. This is our experience في الأونلاين lectures. لسه جديد عشان خاطر الظروف اللي احنا فيها. أنا هبتدي دلوقتي أن معلش يعني mind with me القصص اللي ممكن تبقى صعبة يعني علينا. احنا هنتكلم عن ال childhood obesity، والاوتلاين بتاعنا هنتكلم على ان هو childhood obesity is an epidemic. Should we be screening for obesity? Etiology, differential diagnosis, consequences of obesity, management of obesity, investigations of the obese child. Epidemic. طبعا childhood obesity has now reached an epidemic proportions. Large number of children are presented for medical care. طب احنا بنشخص ال obesity ازاي؟ Obesity can simply be defined as an excess of body fat, although there are more accurate methods for measuring body fat. زي ال body mass index is the only method that is feasible outside research. ال body mass index is calculated من الفورمولا اللي هي body mass index weight 4 على height squared. Childhood obesity has shown dramatic increase in the last decade. Figures vary as much in consistency as how obesity is defined. As many as 30%, 30% من 11-year-old were overweight, 85th centile, with 17% were obese, 95th centile, with a significant rise over only a 3-year period. Should we be screening for obesity? The answer is definitely yes. If we consider obesity to be an epidemic, the question arises whether screening should be introduced. Obesity does indeed fulfill most criteria for a condition that justifies screening. حاجة سهل إن احنا نسكرين ليها، حاجة ممكن تعمل مشاكل، حاجة ممكن تعمل long-term issues and problems. The fact that we have no effective treatment, most pediatricians therefore at present see no justification for identifying obese children. هنعمل ايه؟ ما هو ايه الحل؟ لكن definitely الاعتراف ان في مشكلة هو اول طريقة للحلول. This does not mean that we should not have a robust method for monitoring the epidemic. الاتيولوجي بتاع الobesity. The vast majority of obese children have nutritional or exogenous obesity, and the explanation for the recent rise in figures is undoubtedly a result of societal changes. المجتمع حوالينا بيتغير. الامتي كالوريز بقوا موجودين، الاكل اللي موجود في كل حته واعلانات الاكل اللي موجوده في كل حته عامله مشكله. A useful concept is to consider that we are now living in an obesogenic environment. كل حتة إعلانات، كل حد بيكسايت الطريقة اللي احنا المفروض ناكل بيها. الcommon causes زي nutritional exogenous obesity والpsychosocial. والpsychosocial دي is a different cause لأن هو ممكن تبقى في مشاكل في البيت هي اللي عاملة القصة دي. Rare causes, syndromes, for example, Prader-Willi أو Prader-Willi, endocrine, hypothyroidism, Cushing, hypothalamic و single gene defects. It's important إن احنا نفهم إن أغلب الحالات are nutritional exogenous obesity. The differential diagnosis, when evaluating a child for obesity, it's important to consider causes other than nutritional obesity. They are rare, but they can generally be suspected on clinical examination and we can rule them out easily. ودول المهمين to rule out. The gross charts provide the first clue to the non-nutritional cause. زي ما احنا شايفين الجروس شارت ان ده عيان اوبيز او اوفر ويت لكن الهايت بتاعه قليل. ده عيان خارج بره السنتايلز والهايت بتاعه كتير. ده عيان ابتدى الهايت بتاعه يقل. ده denote an endocrinological factor. ده denote a nutritional aspect. Endocrine causes are vital to identify as they are treatable. Genetic syndromes, clinical features that suggest that obesity may be a result of a genetic syndrome. زي short stature, severe unremitting obesity, onset of obesity before the age of 2 years, dysmorphic features, microcephaly, learning disability, hypotonia, hypothyroidism, eye abnormalities, skeletal abnormalities, sensory neural deafness, renal abnormalities, and cardiac abnormalities. The consequences of obesity are very important. The child that's obese is loading his body and his metabolic systems كلها. مش بس loading بس في emotional و behavioral aspects. في orthopedic زي البلاون disease, bowing of legs, زي slipped capital femoral epiphysis. Asthma, definitely one of the reasons of heart controlled asthma is obesity. Sleep apnea, pseudotumor cerebri, و POS البوليسيستيك ovary syndrome. الاوكلت بيبقى فيه impaired glucose tolerance وعرضه اكتر ان يجي لهم diabetes, hypertension, dyslipidemia و fatty liver او steatohepatitis. Management of obesity, it is very challenging. And ليه؟ لأن أصعب حاجة تملي في التريتمنت بتاع أي health concern are the diseases that need behavioral intervention and that need change. يعني تملي we give the example إن الحالات اللي بيتحط على علب السجاير ما بيخليش المدخنين يبطلوا تدخين، بيخوف عدم المدخنين من التدخين. ف it is very hard to change human behavior, especially when it comes to health. Pediatricians often find the management of obesity very unrewarding لأن المشكلة إن أغلب الحالات بتبقى حالات encounters مش relationship، وحاجة زي كده محتاجة ongoing coaching و time consuming. Most find it hard to help children achieve a meaningful reduction in weight through periodic attendance at the general clinic أو pediatric endocrinology clinic. ولكن what we can do is identification of a medical cause, identification of any consequences of obesity, promotion of weight loss أو control, and management of medical problems. تملي في الحالات دي we need to pick up what is being done right. يعني بلاش نقول للطفل مثلا ما تاكلش ايه، تعال نقول له ده كل ايه. فلو هو he's well fed on right calories مش empty calories هيبعد عن الحاجات الوحشه. فنقول له كل ثمار فاكهه، كل خضار، ده هيقلل ان هو هياكل نشويات وبروتينات. One of the things that's very important in now over protein intake is one of the most important reasons for obesity. The diagnostic process, history, age of onset, diet and eating behavior, physical activity and inactivity, school and social issues, sleep problems and daytime, somnolence, hip and knee pain, menstrual irregularities, symptoms of hypothyroidism, family history of obesity, family history of early heart disease. Physical examination, we measure and plot the growth, height, body mass index, waist circumference, blood pressure, using the appropriate cuff, dysmorphic features or sign of Cushing أو hypothyroidism, acanthosis nigricans اللي بتدينوت الميتابوليك syndrome والهيرشوتيزم. The waist circumference charts, they exist and they are very important for prognosis. Investigations in an obese child, thyroid function test, urinary free cortisol or diurnal cortisol, genetic studies, chromosomes, DNA for Prader-Willi, and genetic of obesity study in Cambridge بنعمل tests معينة. The consequences of obesity, fasting lipid screen, liver function test, urine glucose, fasting glucose and insulin, oral glucose tolerance test, and if at high risk for diabetes, sex hormones binding globulin, FSH, LH for polycystic ovarian syndrome, oxygen monitoring for sleep apnea with sleep studies. Clinical features suggesting a genetic syndrome زي ما قلنا short stature, severe unremitting obesity, onset of obesity before the age of 2 years, dysmorphic features, microcephaly, learning disability, hypotonia, hypogonadism, eye abnormalities, skeletal abnormalities, sensory neural deafness, renal abnormalities, and cardiac abnormalities. What are we hoping to achieve by the intervention? Ideally, one would hope that effective management would aim to return the child to a body mass index where morbidities are reduced, that is below the 95th centile على الشارت بتاع البody mass index. A classic pediatric dogma states that we should be aiming for maintaining weight while allowing the child to grow, so to reduce their body mass index. تملي بنحب نخلي شكلها أحلى ونقول you are not short, you are short not fat. هتطول هتدخل جوه الكيرف. بس again the most important thing is changing the behavior before seeking medications and before seeking later on could be حتى bariatric surgery. The approach may be valid for early years of childhood, but it's hardly appropriate for a teenager who is 170 kilos and who has little growing left. Systematic reviews indicate that with aggressive treatment, reduction in overweight by 10 to 20% may be possible in short term at least. Adult literature informs us that a weight reduction of 10% brings health benefit. Set realistic small goals. Perhaps a reduction of the body mass index over time of 10% should therefore be our set target. Lifestyle interventions are very important. And dietary advice, behavioral modification, physical activities, keeping a diary of what the child eats, keeping a diary of what he improves, and try to tackle it one problem at a time. آخر حاجة بنلجأ لها drugs أو surgical treatment. It is not a diet, it's not a phase, it's a permanent lifestyle change. A healthy balanced diet, 50% fruits and vegetables, 25% protein-rich food, and 25% whole grain, fiber-rich. Easier said than done. It is very hard to achieve that, except if the child eats كله في البيت. مفيش للأسف في أي حتة بره في الكشاك في الفاست فود الكلام الهيلثي ده. 60 minutes or more a day of physical activity is very important. محتاجين نشفت القصة دي كلها to the left وما يبقاش المنظر ده. محتاجين نمنتين السكرين time. Lifestyle changes may be the primary approach, but medication should only be considered in combination with a diet and exercise program. Drugs feel orlistat. It acts by inhibiting the pancreatic lipase and increasing fecal losses. بتعمل زي steatorrhea. والسيبوترامين induces anorexia by inhibiting neuronal reuptake of serotonin and noradrenaline, لكن ليه side effects. Metformin, which is the famous anti-diabetic drug, which induces weight loss in some individuals. The surgery as long-term success of lifestyle intervention and pharmacotherapy in severe obesity has been somehow disappointing. More aggressive approaches such as surgery are already being considered in morbidly or extreme obesity with severe comorbidity. Thank you on the behalf of the pediatric nutrition department, I hope إن الموضوع يبقى كان كويس واستفدتوا منه.